Thank you very much. Good morning to you all. I think we're probably all sick of hearing about COVID, but I thought it was a fitting opportunity to kind of like reflect on some of the lessons that we learned from it as we go forward and advance, if that's okay with yourselves, basically. As always, I have no conflict of interest to declare as part of the presentation, so just to make you aware. Just a bit of an introduction. I think we're all pretty much aware, basically, that there's a significant catalogue of illnesses that for which there's morbidity and mortality that can arise from ambient air pollution, basically. And I think we're all very much appreciative of this. This is why we're here. This is why we're here to have this discussion as a group of multi-stakeholder and of stakeholders working in this field around air quality. We do also appreciate that there is significant pathophysiology behind stuff, and I know we just saw that with respect to the impacts of asthma. And I'm not going to give you a physiology lesson about it, but just certainly to let you know, in as much as what you breathe in, basically, it does have significant impacts throughout your body. And in this instance, I'm just concentrating on the impacts it has on your lungs, and there are multiple pathways by which this can happen, and this can happen for any of us from that point of view. So taking all of that into account, basically, we do appreciate that in 2020 we went through a significant change in terms of a global pandemic. And as part of that, we saw the introduction of what we can now probably reflect on were very draconian transport restrictions in terms of limiting us being able to move around, to kind of like essentially try to burn out an evolving pathogen which had come into us, which had come into being. And these measures, as we can appreciate, dramatically reduced traffic volume and urban mobility. And I bring this into account from the perspective that we must also reflect and think back to about 50 years ago, how our parents got around and moved around in terms of their transport, and the impact from that environment is very different as it is for ourselves. But we also must think in terms of going forward in 50 years into the future, in terms of transport and the impacts that potentially how we move around can impact on the health and well-being of those who live within the societies that we exist in. And I think it's important to take that into account. And we heard only this morning that there's going to be changes to the legislation in terms of the level, the thresholds which are considered to be deleterious in terms of human outcome, and those levels are going to be dropping. So we do need to kind of like start thinking in terms of not necessarily more. I wouldn't necessarily be prescribing for more draconian measures, but we certainly do need to think about measures that can significantly augment and change how we get around, how we move from place to place to essentially cope with this burden of ambient air pollution. And as part of that, as I said, I'm just going to reflect on lessons learned from the transport restrictions as part of that. And this opportunity, as we do appreciate, it created a natural experiment, not necessarily providing causality, but certainly an ecological study, just to see the public health impacts of essentially what happened to cleaner air to those of us who existed within it. This work was undertaken in collaboration with the HSC, the EPA, and DCU from that perspective, and we hope to look at the reduction in terms of this urban mobility and how it impacted on air quality, which we appreciate there was some improvement, the impact on respiratory health, and just for ourselves, we need to ponder this as a group of stakeholders, the impact this will have in terms of future public health policy. In terms of the key findings from this work that was undertaken, and I think we've probably all seen some of not necessarily these specific slides, but in terms of the outcome from the EPA, I've just also added some data in terms of bioaerosols, as you've just mentioned from the Asthma Society, in terms of fungal spores, because I do think we need to start incorporating and thinking more widely to encompass all things that can impact human health. So we can certainly see the seasonality in terms of fungal spore levels in that regard, and then I'm just overlaying the nitrogen dioxide levels from that point of view, and just taking a look over a period of time, and particularly for 2020 in terms of the ambient air pollutants, just in an eye of faith for this point in time, just appreciate that certainly when the transport restrictions were in place, the levels had gone down. In terms of PM 2.5, again, there are mixed sources of this, but certainly urban transport is certainly a cause, a contributing factor to it, and that also seemed to dip during that 2020 phase. The PM10 didn't dip to the same significant levels, but anecdotally just looking at it, it does appear as if there was a trend downwards. And that's just to focus your attention in terms of when the transport restrictions were in place. And then in terms of undertaking, just to lend plausibility to it, statistical testing to reveal, we do notice, particularly for the nitrogen dioxide and the PM 2.5, that there was, and we do appreciate statistical changes in terms of the baseline, in terms of when transport restrictions were in place and when they weren't in place. In terms of overall impact, in terms of admissions for respiratory illnesses, and the ones I've chosen to focus on are asthma and chronic obstructive airway disease. And as you can see, that's just the plot in terms of asthma hospital admissions within the Dublin area during that time. And again, until I put the box over, just appreciate the eye of faith in 2020, there was a bit of dip in the hospital admissions. And we can also appreciate roughly the same thing for the chronic obstructive airway disease. And just as a marker for consistency in terms of hospital utilization, I just chose a disease for which, as best as we are aware, there isn't an established link in terms of ambient air pollution or other biosols. So that's chronic liver disease. And again, that phase and period is there, and we can appreciate there was a bit of a dip there. In terms of the impacts, we did appreciate, as I said, there was a decline in respiratory admissions, statistically that for asthma and chronic obstructive airway disease during that period. I'm not necessarily assigning causality, but we do appreciate that there are pathophysiologic impacts of air quality, and by that we can lend some kind of associated relationship through that. In terms of stability, as I said, the chronic liver disease, there weren't statistical changes there. So in terms of the overall hospital utilization, we do appreciate that was very much still the same during that phase. And then some further work just to characterize what was ongoing there. We looked at nitrogen dioxide levels and correlated them with respiratory admission data from that point of view. And we do appreciate, as we're somewhat aware, that for our own setting, that nitrogen dioxide was certainly, in terms of the levels, was certainly a marker for asthma and chronic obstructive airway disease admissions from that point of view. And again, certainly highlighting its impact as a risk factor, that a modifiable risk factor we need to work on. And I haven't gone into it in great detail because time is short for me here, but just certainly to appreciate there's just a complex, pollutant health dynamics impact that we took a look at from that point of view, and we do associate, the other ambient air pollutants didn't have the same level of impact, but we do also appreciate that their sole source or the origin of like PM 2.5 and PM 10 isn't necessarily strictly from transport, but it still needs to be taken into account in the wider brief. In terms of the additional data looking at fungal spores and their impact for lagged analysis, this is probably particularly interesting to yourself from the Asthma Society. We can appreciate it didn't necessarily cause an acute issue in terms of admission rates, but certainly in terms of peaks, there were delayed admission rates following high levels of fungal spores from that point of view. So again, issues with respect to issuing and making individuals who are medically vulnerable aware of when there are peaks in that phase certainly is important from that point of view. And as you can see, that impact doesn't just have an immediate effect, that impact has a prolonged effect, so it does need to be taken into account in terms of the advice that's offered. Chronic obstructive airway disease, it wasn't as easy to kind of like tease that out, but certainly we do appreciate it needs to be teased in and looked into a bit more. But it certainly does highlight the importance of time-sensitive triggers, and this comes back to the issue of asthma. So it's not just an acute event; it's a journey that the individual is ongoing. So it does need to be taken into account from there. I know that's quite a bit of data to go through, but I thought I would offer those points to yourself so we could move into reflecting in terms of the public health implications of what's been taken on there. And for ourselves as a group of stakeholders, I think it's important to consider the actionable insights for health policy from that perspective. Air pollution and respiratory health. Air pollution is a modifiable factor. We can make a change, a difference to it from that perspective. In terms of transport policy, urban mobility policies that have a direct impact on respiratory outcomes do need to be taken into account and adjusted in terms of, lending to increased or improved outcomes for those of us who live within those areas. I think it's important, as I said, to ponder that and think of it. The legislation is going to be changing in terms of the thresholds for which action is required, and potentially if we don't modify and change our transport policy, we will go through phases where we do have to stand and offer an explanation as to why we're not doing something more substantial to alleviate that in terms of the health outcomes. It's important, and I was discussing this with Anne only this morning, basically, about being able to link our environmental systems, our environmental results with our healthcare system results, because it's important to be able to integrate those things to offer greater credence in terms of why it's important to make these changes. How our systems currently exist, they exist in silo. It's very important that we're able to gather this information, but these systems need to be able to speak to each other. And given the age that we're living in terms of AI intervention and moving forward, and I know there are legal aspects that need to be teased out from that point of view, I think that certainly needs to be looked into in greater aspect to strengthen our position in terms of advancing these pieces. Health equity is also certainly something that needs to be considered as part of this. And I know the conversation necessarily hasn't shifted to it, but certainly having advocacy groups present certainly do highlight that medically vulnerable individuals are certainly at greater risk if we don't look to invoke health policy that will lend to improvements for those of us living within society. We also have to consider the social gradient, and again, that is an equity issue whereby individuals who are on the lowest end of the socioeconomic scale also have less favourable outcomes. So we do need to think of this as a greater societal level as well. In terms of policy and advocacy recommendations, and certainly stuff for us to be able to ponder again as a group, I think sustainable transport promotion is certainly something that's vital and important to us. And we certainly heard that in the first phase of the chats this morning, considerations around active transport that's safe and accessible for all of us, consideration of introduction of low emission zones, and, certainly investment appropriately in public transport. Air quality and green infrastructure, standards need to be strengthened and, ensure that infrastructure is supporting to improve the ambient air quality is certainly vital. I mean, this meeting is certainly a step in the right direction in terms of cross-sector collaboration, but beyond this, we need to be able to take this collaboration outside of these meeting forum and, be able to foster greater greater outcomes in terms of improvement for health outcomes, in terms of improving issues within the environment as well. I think it's very important for those of us who are within the academic sphere also to understand the importance around advocacy and education in terms of promoting this public awareness and leadership on this phase from that point of view, and being able to integrate that. And I have specifically mentioned medical curricula because that's the field that I currently work in, but certainly for those who are yourselves who are in academia, not necessarily in the medical sphere, it also does need to be considered, because this is something that is going to impact us all, and we all need to consider some collective response of how we will advance it. In conclusion, if I haven't been completely nihilistic and scared you witless from that perspective, I do think it's important we just consider, and I leave these messages with yourself to just ponder from that point of view. Cleaner air isn't just an environmental goal, it's a public health imperative, and I think that's something that's very important to ourselves. As I said, how we did things 50 years ago is very different to how we do things now, but we also need to start planning for how we're going to do things in 50 years' time. We, as an individual, we currently inhabit the space that we live in, but we borrow it from our grandchildren, and we need to be able to be assured that when we hand it over to them, that we hand it over in hopefully a better state than when we got it. The COVID-19 period, I know it's shutters for us all, showed us what was possible when you consider action for intervention. I don't think we'll ever probably face such interventions going forward, but we do need to consider what we can learn from that and the gains that can be gotten from it from that perspective. And just coming back to the theme for the meeting, I do think it's important that we're able to stress, with whatever sphere that we work in, that cleaner and healthier lungs should be a guiding principle for future urban and healthcare policy development. And just very quickly, I'd just like to thank and call out a few colleagues: Pat Kenny, Niamh Connolly, David O'Connor. Thank you very much for holding my hand and for taking my endless emails. And just for our colleagues, from our HYPE, the EPA, DCU and Met Éireann for the data that was provided to support this work that was undertaken. And just like to thank you there. 8 seconds over. Apologies. Thank you very much.